The University College Hospital, Ibadan, has launched an Interventional Radiology Centre to reduce cancer. The project was made possible through a partnership of the Tertiary Institution with RAD-AID International, a US-based non-profit organization. Professor Jesse Otsebayo, the Chief Medical Director, who was represented by the Chairman, Medical Advisory Committee, Dr. Victor Akimoladun, said IR offers one of the most advanced accurate diagnosis and treatment protocols in diseases like cancer.
It's a type of minimally invasive type of care that cuts across virtually all specialties. You just heard in the presentation that was made an individual who had what we call radiculopathy, some pain that is severe pain coming from a nerve. And through interventional radiology, pain can be treated. So there are people with intractable severe pain that medications have not been able to sort out for them.
The head of Interventions Radiology team, Professor Biodun Adeyinka, said IR could replace unnecessary surgical procedures and effectively reduce the rate of diseases like breast cancer.
Interventional radiology is an advancement in medicine, and what it simply means is that there are some interradiological procedures that are minimally invasive that can replace surgical procedures, which means rather than the patient go for surgery, we can do some radiological procedures using either ultrasound, CT, or MRI. These are imaging modalities or X-rays to guide that procedure so that we can then use it to treat that particular disease, which otherwise surgery would have been used to treat that disease. So it's an advancement. It will save the patient a lot of cost. It will also reduce complications coming from surgery.
Also speaking, Dr. Stephen Hunt, an associate professor of radiology, said that the introduction of IR in healthcare delivery process would pave way for the country to be a leader in quality and effective healthcare system.
I have traveled all over the world to many countries to help bring interventional radiology. Nepal, Vietnam, India, all over. And I have a special place in my heart for your country, okay? And I came last year, and I looked around and I said, where can we do this? Where is the best place to do this? And that's why we have come to UCH this year. I think it's going to improve the patient's experience here in Nigeria for many reasons. One thing is you simply don't have enough surgeons and enough anesthesiologists to take care of all the patients that need care. In addition, for the patients, they cannot afford, many of these patients don't have a lot of money. They cannot afford to live in the hospital for months and months and months, okay? They need to come in, get a procedure, relieve the problem, and go on with their life. And that's what interventional radiology allows you to do. So the patient comes in, for example, the gallbladder is sick. You don't need to wait and get surgery and take out the gallbladder. You simply put a little tube in and drain the infection from the gallbladder. The patient can go on with their life, get back to work the next day. That's how minimally invasive the procedure is. It's not like a big surgery where they're stuck in the hospital for weeks. Instead, they can get back out to work. And so it really will change the way healthcare is practiced in Nigeria.